Hello, fellow nurses. I'm Patti, and welcome back to Beyond Bedside with Pati. I am so glad you're here today because we're talking about a career-changing topic. If you've been exploring utilization management nursing, you've probably heard the term medical necessity popping up everywhere. It's the bread and butter of UM. And if you're anything like most nurses I talk to, you're probably thinking, okay, I hear that term all the time, but what does it actually mean in the real world? Honestly, when I first started learning about utilization management, I thought medical necessity was pretty straightforward. I thought it was just black and white. I assumed it just meant determining whether a patient was sick. Simple, right? But as I got into the field, I realized it's a bit more nuanced than that. Today, I want to break down medical necessity in plain English and explain why it's such an important concept in utilization management nursing. Let's get into it. One thing I think surprises a lot of nurses is that utilization management isn't always just about medical necessity. It's a bit of a balancing act between two worlds. Depending on the organization and the role, we're often looking at two distinct things when we review a case. We're wearing two different hats. First, we ask, is the requested service medically necessary? This is the clinical side where we look at the patient's actual needs. And second, is it a covered benefit under the member's specific health plan? This is the administrative side that looks at the contract. Those are actually two different questions, and understanding the difference is key to being a successful UM nurse and avoiding confusion. For example, a service might be medically appropriate and supported by the provider, but it may not be a covered benefit under that member's specific plan. Think about experimental treatments. On the other hand, a service might be a covered benefit, but the documentation may not support medical necessity at that particular time. The contract says yes, but the notes say not yet. So let's start with medical necessity. This is where your clinical nursing judgment really shines in this role. It's why we need nurses in UM. One of the biggest misconceptions I hear is that medical necessity means determining whether a patient is sick. We have to unlearn that. That's usually not the question. Most of the time, we already know the patient is sick. That's why they are in the healthcare system in the first place. The question is whether the documentation supports the requested service or level of care based on established, evidence-based clinical criteria. Let me give you an example. Let's say a patient comes into the hospital with acute chest pain and a history of heart issues. Nobody is questioning whether that patient needs medical attention. They definitely do. But what kind of setting is right for their specific presentation? The question becomes whether the documentation supports inpatient admission, observation status, or perhaps another level of care entirely. We look at the vitals and the labs. That's where utilization management comes in. We're reviewing the clinical information and comparing it to evidence-based criteria like interqual or MCG. The same thing happens in prior authorization. This is a very common area for remote nursing roles. Let's say a provider orders an MRI. The question isn't whether the provider wants the MRI. We know they do. The question is it supported by the notes? Is there a reason we're doing it now? The reviewer is looking to see if the documentation supports the request based on established, standardized clinical guidelines. It's about consistency. The same concept applies in post-acute care. This is a huge area for UM nurses, and it's very rewarding to help patients transition safely. Maybe a patient is being discharged from the hospital, and the team is requesting a skilled nursing facility or inpatient rehabilitation for further recovery. The reviewer is looking at the documentation to determine whether that specific level of care is medically supported by the patient's current functional status. One thing I've learned over the years is that documentation truly tells the story. It's the most important tool we have as clinicians. Sometimes a patient may absolutely meet criteria clinically, but if the documentation doesn't clearly tell that story, the reviewer might be stuck in a difficult spot. This is why we often say, if it isn't documented, it didn't happen, at least from the perspective of a medical necessity review. We need the proof on paper. Now let's talk briefly about some of the actual tools we use in utilization management to make these important decisions every day. Many organizations use interqual or MCG. These are the gold standards for evidence-based clinical criteria in the industry today. They're not designed to replace nursing judgment. Instead, they provide a structured framework for evaluating medical necessity consistently across cases. Your nursing brain is still the most important factor. These tools just help us ensure that every patient is evaluated against the same high standards every time. Another huge misconception I hear is that utilization management is all about denying care to save the insurance company money. That's a myth. In reality, that's not the goal at all. As nurses, our primary focus is always the patient's well-being and their safety throughout the process. The goal is making sure the right patient receives the right care at the right time, and importantly, in the right setting for their recovery. When a patient is in a setting that's too high for their needs, it can actually be a safety risk. helps manage that risk by finding the sweet spot. Let's look at things like durable medical equipment or home health. These are huge areas where medical necessity really comes into play. Is a specialized wheelchair medically necessary, or would a standard one suffice? The documentation of the patient's functional limitations tells us that. With home health, we're looking for homebound status. If the documentation doesn't show the patient is homebound, it might not meet medical necessity for that service. As a nurse, you're the first line of review. You're analyzing these complex cases and applying your clinical expertise to every single one. If a case doesn't meet criteria, it often goes to a medical director for further review. Nurses don't deny care. We find the support or escalate. Many nurses worry they'll lose their clinical skills in but honestly, you use your brain more than ever. You're looking at the whole patient picture. And let's not forget the perks. Many roles are remote, offering that coffee chat lifestyle we're talking about today. It's a huge quality of life upgrade. You're still making a difference. By ensuring care is appropriate, you're preventing unnecessary procedures and ensuring resources are used wisely. I know we've covered a lot of ground today, so let's do one final quick recap before we wrap up our coffee chat. First, medical necessity is not simply about whether a patient is sick. We start from the assumption that they need help. It's about whether the documentation supports the requested service based on established evidence-based clinical criteria. Documentation is your best friend. And second, remember the two hats. We're often looking at both medical necessity and benefit coverage. You have to check both boxes. These concepts form the absolute foundation of nursing. Once you master these, you can work in almost any area of the field. If you're interested in making that leap from the bedside to a remote role, mastering these fundamentals is your ticket in. I believe in you. It truly is a wonderful career path that offers flexibility, professional growth, and a chance to impact care on a much broader scale. Now, I'd love to hear from you. When you hear medical necessity, what's the first thing that comes to your mind? Any aha moments today? Let me know in the comments below. I read every single one, and I love learning about your career journeys and hearing your questions. And if there's a specific utilization management or remote nursing topic you'd like me to cover next, please let me know that as well. If you found this guide helpful, please give it a like and subscribe to the channel for more content for nurses looking for a change. Thanks for spending some time with me today. I'm so glad we could have this chat. I'll see you in the next video. Goodbye.